Early morning at the Princess Marina Hospital in Botswana's capital, Gaborone. A team of doctors is hard at work. But this is not your typical team that you would find in any hospital in Botswana. It is made up of a special group of doctors from China sent here with the sole aim of boosting the hospital's services. Princess Marina is one of only 2 referral hospitals in Botswana. With a bed capacity of 567, it caters to an average of 600 patients per month, making it one of the most popular hospitals in the country. Much of that popularity is attributed to the special team of Chinese doctors working here.
Since we have Chinese medical teams, has been of great help because we're taking services, specialized services to the people, and we also have had some breaking ground procedures done in the country. So this has been really of great help to us, to the country as a whole, not necessarily Princess Marina.
Some of the new services offered here include acupuncture, a treatment only found at the Princess Marina Hospital and one that is quickly gaining popularity.
I've been here for almost 2 weeks. But since I've been coming here, I'm much better than before.
But the Chinese team does not offer its services to patients only. From time to time, they offer training to their local colleagues, some even being sent to China for further specialized training. One such beneficiary is Dr. Ramabu.
The Chinese government has got a massive amount of resources. The hospitals were very impressive. They had very clean working theaters that I thought we might want to copy here in Botswana.
But it's not all smooth sailing for the Chinese team. Working in Africa has presented its fair share of challenges.
So language probably the most important challenge. Second is the culture, religion issues. Many health interventions, which is very popular and common in China, probably is not good in the African region because religion issue. You can't ask the question in the way which China is very normal.
Most of these doctors have been forced to leave their families back in China and sometimes go up to a year without visiting them. Like this young couple that came here slightly over a year ago. They have a teenage daughter whom they only talk to on the phone.
Yeah, I miss my daughter, but this is a work. It's as a volunteer, we have to stay here for something that is not for my daughter. So she have to stay my homeland with my father-in-law as my father, like this, yeah.
But their work here is cut out, and so every single day they provide their services to the hundreds of patients who need them. And when not in hospital, the Chinese team comes to this house to unwind. For a few hours each day, they share a meal and perhaps enjoy a game or two. They even practice their gardening skills.
We just want to kill time.
But their efforts have not gone unnoticed.
We appreciate their presence here. They have helped us when things were at their worst, when we didn't have enough professionals, medical professionals, doctors, nurses, and so on. And they came to our rescue when we needed that most.
Building Africa's capacity and increasing its medical personnel was one of the key issues discussed during this year's International Roundtable on China-Africa Health Cooperation. And Princess Marina Hospital has provided a perfect example of the benefits that Africa stands to gain from this cooperation. Penina Karibe, CCTV in Gaborone, Botswana.